when we talk about patient flow, we really mean all the things around medicine. So medicine being diagnosis and treatment, we mean all the things that connect patients to that medicine. Challenge of patient flow is 6 of 10 hospitals operate at or near their functional capacity, meaning one incremental patient strains the system. So what those strains look like is long waits in the ED, people wait for weeks to get a surgical procedure or radiology procedure, people wait a long time to get listed for a transplant. Of course, that obviously negatively impacts patient care. It also prevents the next patient from being treated. Time to get to medicine is the primary predictor of the patient outcomes. And so better patient flow has a direct impact on patient care that way. It also has a direct impact on patient care in the sense of giving nurses and the clinical staff more time to devote to patient care. If we talk about reducing crowding in the ED, the primary driver of that is really congestion in the inpatient beds, so lack of access to inpatient beds. Pretty clearly the reason for that is if you look at the discharge curve in hospitals, 60–70% of patients are discharged from the hospital in the mid to late afternoon. Meanwhile, all morning long patients are coming into the ED, but they can't go up to the units until this bolus of discharges clears. Solving that problem, we have found again and again, is really about three things. It's about improving the admission cycle, improving discharge planning, and improving the discharge process. So relatively modest improvements in that discharge curve trickle all the way through the system, reduce wait times in the ED, and ultimately, if deployed broadly, reduce length of stay for the hospital at large. I think if we use that framework of process, scheduling, and governance, that really kind of shines a light on it. And each of those things have to exist in each department. So the OR has a scheduling problem and a process problem and a governance problem. But you also have to solve the OR problem in the context of the PACU, which is the next step down in care, in the context of the ED, as patients go from the ED to the OR, in the context of radiology. So the challenge is improving scheduling, improving process, improving governance in each of those domains and doing it with an understanding of how the domains intersect. If we do all those things together, we'll find a new optimal operating performance level for hospitals, meaning a new level of capacity they can function at, and that'll go a long way towards solving that macro patient flow problem.